Chapter 6, we are talking about sexual offenders. This can be a topic that can be uncomfortable for some folks. Certainly, my background in clinical psychology, having worked with a lot of victims of sexual abuse and sexual offenses, very difficult to have empathy or think of how do you treat folks that violate and sexually offend. But it's something that needs to be addressed. It's something that we have to deal with. The question there, how do we define sexual offender? This chapter will also go into assessment of sexual offending. Can we make predictions of, is there recidivism? Is there a high rate of that? Can we predict whether they'll reoffend or not? And also different ways to try to treat and reform if possible. What is a sexual offender? It says the term sexual offender is largely a legal term used to label anyone who has committed a sexual offense. Most have contact offenses, but increasingly numbers of non-contact offenders, example, their distribution of child pornography, are being assessed and treated. And right here, guys, it says, what do we do with sexting between minors? I've seen this a lot in the work that I've done. Parents will come in and reveal that there's been they've discovered photos on their kids' phones. Schools have found this. It's been reported to schools by one family, and so they have to address it. Local law enforcement gets involved at times. It's difficult. You'll hear of even teens that are consenting, yet under the age, minors. It does still fall under distribution of child pornography, and a lot of them are kind of blown away at that. They're like, wait a second, this was between me and my girlfriend or me and my boyfriend, and it got discovered, and so it gets kind of into the gray area there and tough. So we're trying to do a lot of education, I think, in helping minors understand that it's something that's taken very seriously by law enforcement, and even though it might be something that's considered innocent between consensual underage teens, still something we have to help them understand. It can be very very difficult if it's discovered, and is it actually healthy sexually too? That's a whole different question. But sexual assault is usually defined as the use of force or threat to compel sexual acts. I think typically that's what we think of when we think of a sexual offender. The use of force or coercion, often a big ingredient in making it more clear-cut. Sexual offenders are a highly heterogeneous group from a host of backgrounds: rapists, child molesters, exhibitionists, somebody that likes to reveal themselves in public, Freudists, that's somebody who they frequent crowded places. It's Mardi Gras time in New Orleans right now. Parades, big crowds are popular places for Freudists to be driven by their behavior. And basically, a Freuderist is looking for contact, usually brushing up against somebody or copping a feel, for lack of better terms, in a crowded place, and then trying to escape or act like it was incidental or what have you. Voyeurs, those that like to watch. We think of the neighborhood peeping Tom. That's a classic example of a voyeur. Somebody who is wanting to watch somebody disrobe or somebody involved in sexual behavior without their knowing. So it's violations, no doubt, in most of these considerations. And that's a big thing when we're looking at it. We're trying to determine, is it a legal act or illegal? When you're violating the boundaries of other people, you're definitely, even if you're in the street watching them through a window and you're not on their private property, but if you're systematically kind of, you know the time, when, and where exactly, and you hide out in a place that's still off of their property, but you're violating their boundaries by watching them, considered a violation, definitely. If you look over here, the terms predator and pedophile are often used to describe all sex offenders. So there's a lot more to it than just the pedophile and the predator. Since the term predator paints an especially vivid picture of a person who outstalking his sexual prey as he walks among us. Unfortunately, that vivid picture tends not to be the norm for sexual offenders. No, most of them fall into these other categories, and they're kind of driven by their sexual desire. That's a key component, and not so much a calculated predator who's setting this up per se or premeditating it all. Now, I think some of the other ones are impulsively acting on sexual urges that come into their thinking. So the term paraphilia at the very top there is a clinical term, formal mental disorder. It's listed in the DSM. There's multiple paraphilias listed in the DSM. It's defined as recurrent, intense, sexual arousing fantasies, sexual urges, or behaviors, generally involving the things listed underneath. The DSM, again, you guys heard this earlier in the course, the Diagnostic and Statistical Manual of Mental Disorders, where all mental disorders are discussed and listed. And it's a book of diagnosing all the criteria there for different types of mental disorders. And in this category in the DSM, with paraphilias, they talk about non-human objects. Somebody might have a fetish for shoes, for example. Suffering or humiliation of oneself or partner. I think the thing that comes to mind for most of us would be like sadomasochism, S&M type behavior, where somebody either likes the pleasure of giving pain or the pleasure of receiving pain. Children or other non-consenting persons. This is where it gets more clearly into violations for sure. Think of paraphilia when it comes to children, and other non-consenting persons might be some form of rape or sexual assault. Occurs over a period of 6 months, so it must be something that's pervasive, and usually it goes back, you guys. It doesn't often begin in adulthood. The motion was sort of set earlier on, probably within sexual development, early, through puberty years, through early adolescence. Things were being formulated within the personality structure, but also the idea of sexuality and of what's normal, what's considered abnormal or atypical. And the focus is sexual arousal, definitely. This is the key component. At the bottom there, an individual need not actually perform an illegal act or even illegal behavior if the act is considered deviant from the norm to be diagnosed with paraphilia. Yeah, basically we get an idea, and human sexuality does a pretty good job of developing what are the norms of sexual behavior, especially among consenting adults. So they get an idea of that, and through much research and a lot of polling and a lot of inquiry, and people like Masters and Johnson, and folks like some of the early researchers on sexuality, and then the current information that we have about sexuality gives us an idea of what norms are that the DSM kind of adheres to. And so, once you kind of cross out of what's normal, it becomes more atypical. And a lot of that kind of behavior falls under what we consider to be a paraphilia or paraphilic behavior. The terminology says some confusion. Confusion is more complex when the distinction between a specific paraphilia or pedophilia and child molestation is examined. So looking at some of the terminology here, child molester, any adult who has perpetrated a sexual crime against someone under the age of consent, generally, depending on the states, but generally around 14 to 18 years of age is what we're considering under the age. The child molester usually sticks to that age range, I guess you could say. It could go down or it could go up slightly, but that's usually a good idea of the range. The term pedophile is slightly different than child molesters. It's someone involved in sexual activity or experiencing significant stress over sexual urges or fantasies involving a prepubescent child, usually under 13. So their focus is more of the younger child. So again, once we go above the age of 13, we usually consider them child molesters. If it's, I know it sounds synonymous. We've always kind of thought of those terms as being the same, but clinically we distinguish this way with the age. An individual could be a child molester and not a pedophile, or in a rare circumstance, a pedophile and not a child molester. Some believe all child molesters are pedophiles, so that helps us kind of, distinguish between the two slightly. Although there's a lot of similarity in how they maneuver and how they go about, and even sort of the ideas of sexuality underneath the person themselves. So how do we assess sexual offenders? One of the ways is what we call a phallometric measure of sexual deviance. And as you can see in the bullet points here, the physiological device, typically a physiological device, that records deviant response patterns and usually consists of stimuli, monitoring equipment, and recording instruments. It's underlying the notion that sex offenders are motivated to engage in their antisocial behavior by their deviant preferences. So we're trying to measure that. We're looking at those deviant preferences and seeing if they're, when presented with stimuli that are deviant, are there physiological responses? In other words, do we have sexual arousal when shown film, whether it's photographs or film? And so we've come up with some ways of doing this. If you look in the green here, the forensic psychologist is not evaluating whether an offender has committed a particular crime, but whether there's evidence suggesting treatment responsiveness or future risk. Experts in the field strongly recommend against the use of sexual offender assessment results to suggest the guilt. So we got to be careful. Just because somebody does respond with sexual arousal when presented photos, we can't then assume that they're guilty of a crime. That's demonstrating that they do have a reaction to that, as opposed to other people that would not be sexually aroused when shown photographs of children and maybe sexually compromising pictures. We'll talk about that in a second. Anyway, suggests guilt or innocence of an individual because it lies outside the scope of practice of forensic psychologists and is not supported by the psychological research. So we have ways of measuring this, of assessing, right? But sometimes the research doesn't allow us to then suggest the guilt. It's not strong enough to really say this person is guilty or innocent, because there are some folks that will be presented with that won't show any sexual arousal, but actually had committed a sexual assault or a sexual crime, but for whatever reasons they're able to beat a phallometric measure test of some sort. So we've got to be careful when using them. They're helpful, though. And the phallometric assessment, the penile plethysmograph, or PPG, this is one of the more common ones, or ones that it's controversial, but it's a way of finding out if somebody does respond in a sexual manner. It says, used to determine sexual interest of male sexual offenders, consists of some sort of sexual stimuli, which is usually pictures or photographs or video, monitoring equipment placed on the individual, placed on their penis, for a male, obviously, and recording equipment. Monitoring equipment measures the heart rate, skin conductance, or perspiration, and penile engorgement. The individual is presented with audio or video, sexually deviant stimuli, along with a neutral or sexually appropriate stimuli to see which one that he responds to, how he responds to it. The idea is that if an individual exhibits a response to deviant stimuli, like photographs of children, he has similar urges and fantasies outside of the testing situation. So we're generalizing that not only is he reacting here with the penile plethysmograph, that he probably does when he sees a child or when he's in an environment with a child. We're kind of making a leap here, but at the same time, maybe if this is playing out within an environment or a testing environment or in a lab, can we generalize that to real-life situations? Some people would say yes. The limitations. Nude pictures of children engaged in sexual acts are against the law, right here in the green, and not used anymore. Pictures of children with accompanying auditory description of a sexual nature could be used. So it says, would this cause problems in the results? Because we're not able to show, I guess, as graphic of pictures or film that they used to do when they first started using these phallometric assessments. The law now prohibits us to use graphic pictures. But does that skew the results of the test? Some people would say, well, yeah, they're not showing engorgement, they're not showing more perspiratory rate or what have you, or perspiration, but because the pictures are more benign. If we showed them graphic pictures, we'd say they'd probably react to that. I mean, we're now kind of guessing, so it kind of prohibits how far this measure can actually go. Studies show that phallometrics exhibit discriminant validity and can differentiate child molesters from non-offenders. Studies also supported